Now, the tragic death of a man who collapsed at a club in Manchester has given new urgency to the long-running debate on drugs. Police are investigating whether a bad batch of drugs caused his death. So would testing what clubbers are about to take save lives? We've been to Vienna, where toxicologists are on hand to tell people whether their drugs are cut with a host of other substances. There are those who argue that would work here because in England and Wales alone, 2,500 people died last year from drug poisoning. And to add to the debate, this weekend, the Chief Constable of Durham renewed calls for the legalisation of drugs, saying prohibition hadn't worked. We'll discuss that in a minute, but first, Cordelia Lynch reports from Austria.
A nightclub in Austria, the usual scene anywhere in Europe. Bright lights and some dodgy dancing. But this is where the predictable ends. A team of scientists on hand to test how pure your drugs are. A free service some want here in the UK.
It's good that you know what you are going to take.
I really think it's a good idea.
You can see it contains no ecstasy, but it contains this nasty compound PMA.
Do you think it could save lives here?
I think it would save lives.
In Britain, there's a deadly game of cat and mouse going on. Chemists concocting drugs quicker than the government can ban them. But some countries are taking a different path. I've come to Vienna to see if there's anything Britain can learn from the way they tackle drugs and treat users here. This is where it all starts, a mobile drug laboratory at Vienna's General Hospital. Rainer Schmidt and his team are preparing to spend the night testing clubbers' drugs. They'll be looking for signs of contamination.
So, that's it.
Users may not think that there's that many components.
No, what they think they take, and the drug they take in reality is maybe more toxic, more dangerous.
Of course, the eyes can be deceiving. Vienna appears a pretty conservative society. But it's also a wealthy one, and the people are well educated, and that seems to be influencing their attitude towards drugs. Many want to know more about exactly what they're taking. Later that night, the thirst for knowledge is intense. The team are scraping tiny shavings from pills before they're taken to the laboratory. This is an anonymous service, and the customers won't be prosecuted. They're offered counselling too. Most didn't want to be identified.
I bring today cocaine and MDMA. Yeah, I tried it out before. It's my 5th time.
Do you wish this was more open and that you could be public about it?
Yeah, for sure, because drugs are everywhere.
What did you get tested?
It was LSD.
And what if you find out it isn't LSD? Will you still take it?
No, I don't think so.
And that's the reaction the team want. This is all based on harm reduction. The project is paid for by the city of Vienna. The detailed analysis is done off-site. Well, we're now driving to the hospital. It's about 10 minutes away from the club. And these samples will be handed over for testing. The whole process, from when the user gives over their drugs to when they get the results back, takes about an hour. Anton, it's 2 in the morning. You've looked at about 43 samples already. Any surprises?
We've seen a lot of cocaine containing levamisole. It's basically an anti-warming agent for pets. The danger associated is that we don't have any data about it. There is no data about interactions. And so basically the user does not know what effect he has to it.
Back in the club, the colour-coded results board is filling up. The red is a warning about the dosage and chemicals. Well, here's just one example. The person thought they were getting cocaine. In fact, they were getting 4 other substances, including caffeine and an anti-worming agent. But do people think this clinical precision could lull some into a false sense of security?
They do it really professional. They do it with this whole test scheme, what they're asking you about, like where you got it from, how long is it ago, do you get it from a friend or from some strange guy?
Never had pure cocaine. There are for sure at minimum 3 other integrates inside.
I think probably people are safer in Vienna because of it.
No.
No.
I don't think so. But it's good that you know what you are going to take. No, it's a service. It's a public service for you.
Of course, the obvious argument is this condones drugs.
No, definitely not. We go to the people and accept that they are and want to take the drugs, and we can just influence their decisions.
Back in Britain, there is little prospect of a state-sponsored testing scheme anytime soon. But there is a pressing problem here. A think tank recently claimed the UK has Europe's highest rates of addiction to cocaine, amphetamines and ecstasy. Many people I spoke to said testing makes sense.
Definitely, yeah, definitely. Because I think it's not just for safety. I mean, on a more kind of practical level, people want to know that they're getting value for money.
If that was an option for me to do that test, I would definitely do it, and I would be like, and it would be a really good thing to have.
There are also a lot of horror stories, so anything that can be done to try and make it a little bit less of a risk is probably a good thing.
People's fears are now focused on PMA, a stimulant. It's sold as ecstasy and takes longer to have an effect, but is far more toxic. It was linked to 20 deaths in the UK last year.
So they're green with an Apple logo on.
John Ramsey has analysed them, but his job is to help the police, not the people taking them.
These are a selection of the drugs we found at Glastonbury.
Would you consider doing this testing for users?
No, we're very careful. We only sell to healthcare and law and order professionals. We don't want to act as the quality control laboratory for the illegal drug market.
But former government drugs advisor Professor David Nutt, who was forced to resign after saying cannabis was less dangerous than alcohol, believes drug testing is essential.
People taking PMA and dying from PMA, they thought they were taking MDMA ecstasy. If they knew they were taking PMA, almost certainly none of them would have taken it, and therefore those lives would have been saved.
It seems that for drug testing to work in this country, there would have to be a pretty big cultural shift, an acceptance that people are going to take drugs anyway, and a decision by the authorities that they have a responsibility to make the drugs experience as safe as possible. But they will want evidence that that actually reduces risk, and there's not a lot of it. Austria and the Netherlands are doing research, but facts and figures won't be enough to influence Britain's policies. It will also take money and a leap of faith.
Well, we did ask to speak to someone from the Home Office, but instead they gave us this statement. The UK's approach on drugs remains clear. We must help individuals who are dependent by treatment, while ensuring law enforcement protects society by stopping the supply and tackling the organised crime that is associated with the drugs trade. Well, joining us now from Bristol is Dr. Tim Williams, a consultant addiction psychiatrist for the NHS and an advocate of schemes like the one we've just seen in Vienna. And from Boston, Kevin Sabet, who served in the Obama administration as senior advisor at the White House Office of National Drug Control Policy from 2009 to 2011, and says schemes like the one in Austria could give drug users the false impression drugs are safe to take. So, Kevin Sabet, first, why, in your view, wouldn't testing save lives?
Well, actually, I think even people in your piece there said that we're not sure if it saves lives. So actually, I would say let's do the data and the studies. If we had testing, and then on the other hand, maybe just an education scheme where you actually educated users on the dangers of drugs at these parties, and to see what would happen, might yield some interesting results. But the issue is, testing can, I think, give the false impression that using pure drugs is safe. In other words, if cocaine is not cut or MDMA is pure, that in some way that's a green light to use. And I worry about that because when we look at the number of deaths, whether it's in the UK or the US, there are plenty of deaths from pure drugs alone. So again,
Okay.
Unless we actually have some empirical data showing it might work, which we don't have, I think it'd be a leap of faith.
Well, Tim Williams, if you find out your cocaine is cocaine and not anti-worming agents, still dangerous, isn't it?
Absolutely, and I don't think anyone's advocating that you wouldn't have a testing scheme alongside the harm minimisation advice that's out there. But fundamentally, you want to empower people who are using the drugs rather than making them pawns of organised criminal gangs.
But, Tim, isn't there a danger that if you know what you're taking, it might embolden people to take drugs and therefore increase addiction?
I don't think so. I think we've seen very clearly from the Netherlands example, where they have very low, much lower rates than the UK of substance misuse, that this kind of scheme works. So I don't accept the argument you've just had on that this is not an effective strategy to help reduce harm. And the time has come that we must do something. There's young people who are dying from contaminants in substances out there, and it's not good enough to say just have an education scheme to sort these things out.
Kevin?
Well, you know, I think, yeah, well, first of all, let's put the scare tactics aside. Actually, the UK, although it's always had higher rates of use than most of other European countries, in the last 10 or 15 years, there's been a dramatic reduction in both drug use and drug deaths, dramatic reduction in injection drug users, dramatic reduction in crack users. In fact, the Liberal Democrat minister, Jeremy Brown, who's currently in the U.S. touring some sites to see the effectiveness of other drug policies, actually has done a wonderful job working across party lines with all parties in the UK, and there have been a very significant reduction in drug use in the UK. So, I mean, I know it's easy to sort of sensationalize and glamorize a few numbers, but the numbers look good right now.
OK, but if that's the case, then why, Kevin, did the Chief Constable of Durham say this weekend that prohibitionists such as yourself have put billions into the hands of villains who sell adulterated drugs on the streets?
That's a pretty heavy charge against me. But, you know, I think there have been a few law enforcement members who have said that they'd rather not deal with the drug trade, let it be supplied by the NHS, for example, for addicts. But really, that is not anywhere near the majority of view of neither law enforcement professionals nor health professionals. In fact, the idea of legalization, I think most people agree, would really put our public health at risk by dramatically reducing the price of drugs, therefore increasing its availability and use. And frankly, I think the UK has a tough enough time dealing with its other legal intoxicant drug, alcohol. The idea that we would want to add any other intoxicant to that list, along with alcohol and tobacco, which is also addictive, I think really makes absolutely
well,
no
alcohol
sense.
and tobacco are much more dangerous in terms of lives claimed, so you'd ban them as well, would you?
Well, actually, they're different in terms of their risk. Obviously, tobacco is the most addictive drug we have. It's more addictive than heroin, but it doesn't cause car crashes like cannabis does. Alcohol and cannabis are about similarly addictive, yet alcohol has a more of an effect on violence. Cannabis has more of an effect on IQ. So this idea that one drug is worse than the other is a completely simplistic way of looking at it. Every drug has different harms. The issue is alcohol and tobacco are here to stay, so making them illegal would be very difficult. But why would we add any other drug, whether it's cannabis or, like the others think, crack or methamphetamine or cocaine, to this drug of legal industries promoting it? I mean, there's a tough enough time dealing with the alcohol industry and the tobacco industry really throughout the world.
Okay. Tim.
Yes, I mean, I'd like to come back on that. The government have got a very poor record of listening to scientists. They've dropped minimum pricing for alcohol, which is a no-brainer technique to reduce alcohol harm. They've dropped plain packaging for cigarettes, which is really poor. They've dropped the cider tax, which is, you know, the police constable talked about strong ciders being the scourge of street corners. So these are very sensible policies that scientists have advised that the government has not listened to.
Listen,
so we want a rational policy for
I don't disagree with
and
that.
science, and we must get some rationality behind drug policy and listen to the scientists. I'm fed up with people coming on and not having a rational approach. I've spent my life and my career trying to help people come off substances, and the American-led war on drugs has been a failure, and we need to do something different.
OK, Kevin, let me just put to you, we've talked about alcohol and tobacco. I'll give you another dangerous white substance. Kills tens of thousands of people a year. Sugar. Is that class A or B?
Right. Well, I mean, let's look at the addictive nature of sugar, the violence effects of sugar. I think we would question that. Again, sugar seems like it's much more here to stay than a substance that's much more addictive, like crack or cocaine or heroin. The last time I checked, sugar really didn't tear apart families the way cocaine, heroin, and crack did. So yes, coffee is addictive. Yes, cannabis is addictive, but those are different things. And listen, I don't disagree with the other panelists in terms of alcohol. But,
I'm really sorry to interrupt you. We've run out of time totally. Kevin Sabet, Tim Williams, thank you very much for joining me.
Thank you.